President Uhuru Kenyatta today applauded St. John Ambulance Kenya volunteers for their exemplary work of charity that continue to save lives. The president said the work of the organization, which includes ambulance services, highway emergency response, first aid and safety training, as well as maternal health care and advocacy, has eased pain in many homes in Kenya.
Tuwapigie makofi tena watoto hawa wamefanya.
I want to take this opportunity to thank all the officers of the order for the support they have given me as their prior. I have been with the organization for over 42 years. I've been at the leadership for close to 38 years or so. So I am delighted what we have been able to achieve is because of all these officers and the support we get from all the members. My term as a prior ends midnight today. Midnight today. Whoever is taking over, I've told him asiwe na haraka mpaka midnight ifike. Ndio nitamwachia. As I reported, Your Excellency, we've gone through, we have appointed Paul Ndungu to be the next prior. He has also served the organization for as many years as I have. He's a distinguished lawyer. He has been a great volunteer, and he has been very, very supportive. His appointment has been approved by Her Majesty the Queen, and the warrant of appointment is already with us. I'll be asking you to kindly present it to him when I finish this. To support him, we have appointed Lazarus Kimanga as his deputy. Lazarus Kimanga he has this big title, Receiver General, but he's basically the treasurer. That's what he makes sure that all our books are in order, and I can tell you, I have admired the commitment from Lazarus. He will come to the office virtually every day, every week. He is there checking, giving up his time to make sure that our books are in order. So we have decided to make him the deputy prior. His warrant will be coming. We were slightly late in submitting the name, but his warrant is being processed, and it should be here shortly. Your Excellency, we have a few individuals who have shown interest and commitment in joining the Council to be able to contribute to the work that we do. and we will also give them their warrant of appointment so that they can join the council to help us move the organization forward. I think in part of my life, one of the things that gives me great satisfaction is the time I've spent with St. John. And it is because of that spirit that I have witnessed from the members of the order. We have over 26,000 members who volunteer their service. That is a big number. And if we had so many people giving that free service to the community, a lot can be achieved. So we need that extra motivation to be able to increase on the number. We want to appeal to the parents, the schools, to help us in instilling this particular aspect of training first aid and the other services that we give to the Kenyans throughout the country. I'm glad to report, Your Excellency, that we are getting quite a bit of support from the county governments, and I'm sure as we go along with these county governments, we will not only be talking of 26,000, we are targeting 45 to 50,000 next year. And I'm sure that number can be achieved. So we'll keep on working diligently to see that that is done. With all these volunteers, Your Excellency, we only have about 30 salaried staff. Otherwise, the rest are just volunteers. It's a great commitment by these people.
Your Excellency, allow me to remind us that what you give comes back to you, as is stated in the Bible. And that today, St. John's family has given so freely of their time, have saved millions of lives in the course of the work that they do as volunteers. And to you today, I wish to thank you and appreciate you for so freely, again, giving of your time in honor of the work that this team before us today does. I want to thank you also as their patron for guiding, and this morning already speaking very directly to the collaboration and partnership that you desire to see in the space of health as we roll out UHC. I take my commitment, Your Excellency, that it will be done, and we will deepen our collaboration. We already are collaborating with St. John's, but we need to do it in a manner that is deeper and that the impact is real. And Your Excellency, you have my commitment that this will be done.
This annual event provides us with an opportunity, first and foremost, to fellowship together in prayer, but more importantly, it allows us to celebrate the milestones achieved by St. John's fraternity in the past 1 year of service to the people of this great nation of Kenya. As your patron, let me begin by applauding all St. John members for your exemplary work across various volunteer services, including ambulance services, highway emergency response, first aid and safety training, and maternal health care advocacy, among many other things that you do. Your contributions to Kenya have inspired hope and helped ease the pain of loss and wiped tears in very many households across our land. In addition, you have inculcated in the hearts of other youth the value of volunteerism, service to others, and helped elicit a high sense of civic duty amongst your fellow citizens. Ladies and gentlemen, I believe I am right to say that Kenya is undoubtedly better because of the St. John fraternity. And with great pride, and on behalf of a grateful nation, I thank each and every one of you for all the good and invaluable work that you do in the service of your fellow citizens. The last function that I attended, the last parade that I attended, when Marsden and his team came to see me, they gave me a tie, and I promised that I would be on the front line of also seeing what I could do to raise funds for St. John's. Sasa leo nimeshikwa tena na nimekumbushwa ya kwamba ulitoa ahadi, na kwa sababu ahadi si ni deni, na deni inafanywa nini? Si ni kulipwa, inalipwa. So today I make my own personal contribution to St. John's of 10 million shillings. As an indication of my personal support to the work that you do, as well as my assurance that my government will work hand in hand with all of you to ensure that we deliver proper care, emergency, but also overall health care to our people. Ladies and gentlemen, as we progress in transforming our nation, ushering in modern highways and transport corridors across our country, we regrettably continue to experience disturbing high rates of fatal injuries, accounting for 88 deaths per 100,000 persons on our roads. It is notable that road accident injury that end up in fatalities are at the rate of almost 21 persons for every 100,000. As a caring government, we have rolled out a number of interventions that focus on addressing the effects of road accidents as well as other emergency disasters, particularly in terms of direct impact on human health and safety. But once again, I cannot fail to record our appreciation of the role the St. John's Ambulance has played in complementing the government's interventions in emergency response and incident care. I also further note that you as St. John's train every year approximately 18,000 Kenyans, including Boda Boda operators, on emergency rescue measures. With this personnel capacity and your 17 fully equipped rescue centers, each with 25 personnel, it has been possible to provide emergency services to an average of 25,000 victims of road accidents annually. The rescue centers, I understand, are capable of providing a range of services, including trauma care, airway management, cardiopulmonary resuscitation, automated external defibrillation, hemorrhage control, fracture and spine immobilization, amongst others. And it goes without saying that given our shared vision to save lives of our people, deepening the collaboration between the Ministry of Health and St. John's Ambulance Service is a must. Focus should be in the management of ambulance fleets and strengthening resilience in emergency and disaster preparedness, mitigation and response, and in training personnel with the requisite rescue skills. And in this respect, I want you to know that the service you provide with compassion have been considered and embraced in Kenya's first ever policy on emergency medical care. This policy is supposed to guide pre-hospital and emergency responses in order to ensure the provision of the very highest standards of emergency health care. I and millions of Kenyans are very proud for the volunteer spirit that St. John's have shown. And I see no reason why we as a government cannot partner with you, coming from different parts of our country, and you taking the lead as our first line of defense against disease and ill health in this country. You are 26,000 of you, volunteers, willing and ready to serve, willing and ready to go door to door. Why should we look for anybody else when you are there? Tufanye kazi pamoja. Tuokoe maisha na tuimarishe afya ya wananchi wetu wa Kenya.